Hello and welcome to Why Medics Matter, a podcast for doctors, by doctors, brought to you by Doctors Training. We are your hosts. I'm Dr Amy Burbridge.
And I'm Dr Simon Fraser. We have a great session with a colleague and friend of mine, Yvette Oade. Yvette trained as a paediatrician. She's former Chief Medical Officer and Deputy Chief Executive at Leeds Teaching Hospitals. She held that position until May 2020. She's attempted to retire many times since then. I've had the pleasure to meet Yvette in different roles, and you rallied the call when COVID came and you did a huge amount of work, support vaccinations. And you stepped in as interim medical director for the region and provided huge support to the team during really quite challenging times. Alongside that, you're a mother and a grandmother to 3 children, some beautiful twins recently arrived, and a wife. It is a pleasure to have you. So Yvette, welcome to the session.
Thank you. It's really good to be here with you and Amy.
I've got quite a tricky question to start with. The current landscape in healthcare in the NHS, it's really tough. As an aspiring leader, it can often feel incredibly overwhelming that whatever we do doesn't seem to make a difference. Have you got any tips on how we can navigate this?
Well, thanks, Amy. That is a tricky question. But do you know what? I think you're right. I think this is one of the most difficult times that we've seen in the NHS. And that's why it really calls for us to get involved and to lead, because I do think things will get better. But I agree that at the moment it's challenging and there doesn't appear to be much light at the end of the tunnel. So the one thing that I think we as doctors can do is remind ourselves that we are all leaders, and we will have views and ideas about how things could change for the better. So the first thing is, don't keep those ideas to yourself. How do you get involved and ensure that wherever you're working, your leadership team will be needing ideas. The one thing you learn as a very senior leader is you do not have all the answers. I think politically there's been a change of government. We know that there is going to be more money coming into the NHS, but we also know that the costs of the NHS are rising rapidly. But I think doctors are great innovators. They, the use of things like artificial intelligence and how we can use that to help us navigate those really blooming hard digital medical records that have got so much information in them. How do you seek out that? But we must remember that sometimes we're also barriers to those changes as well, and we can become quite protectionist about our own little roles. So remaining open-minded is also really important. I'm not sure whether I've really answered your question there, Amy, so please prompt me if there's more.
So what I want to, dig down a little bit deeper into is I get people come up to me all the time with these great ideas. And sometimes I have great ideas myself. I take them to people and say, why should we do this? Should we try this? Let's do this. I've got all this energy, all this excitement. And the response is, it's never going to happen. We've got no money. We haven't got the time. And I think that seems to be happening more and more recently. And what I don't want to do is for aspiring leaders to get so disheartened that they stop coming up with these ideas. So if we get all of these setbacks all the time, any suggestions as to how we can keep optimistic and who to approach if we keep being told that it's not an option?
Yeah, I suppose it depends on the kind of idea. Most things in life we achieve through incremental changes. small changes, and being in a culture where small tests of change can be carried out in a team where you don't really need to ask permission other than get the agreement of the team you are working in. Big ideas that might involve, might involve funding, but actually might involve other teams, other departments, do need to probably be moved up the chain a bit in terms of permissions. And I think I've spent my working life in hospitals. Of course, this could be different if you were working in primary care or community care. But if, say, you were in a hospital, then those operational teams, sometimes we will have a chief operating officer, or you'll have directors of ops, general managers. They're desperate for the ideas. And I think nobody should be worried about you don't have to necessarily stick to going to what you see as your line manager. You can take quite a few steps up in order to get your idea heard. And there is always that difficulty about, we've done it before, we tried it, it didn't work. But actually, I think, it's still worth discussing, because the circumstances and the context in which we work changes, and therefore, just because it didn't work last time doesn't mean there isn't something in that idea that would work this time. So don't be stifled by somebody, particularly somebody who has been there for years. Perhaps, it's fantastic to have colleagues that stay in one place and work in the same department or ward, because we rely on those people. But equally, we have people who want a fresh challenge. They enjoy change. They enjoy innovation, and those are the people you need to try and find in your team, or beyond your team, perhaps, in order to get an idea, to get some traction.
You mentioned there, Yvette, about trying to find people to take on leadership roles. Have you managed to recruit, talent manage, engage people? Because you said there's only a finite amount of your time in the senior leadership team. A big part is developing others. What are your thoughts on this, and if you do any examples where you've been particularly successful?
Well, I think a lot of people need a tap on the shoulder to tell them that they are good, that they've got some ideas. I can remember when I was in my very first house job, and they were called house jobs in those days. It was a medical house job. And the consultant that I worked for was probably reaching the latter part of his career. But as I was finishing that job, he told me that I had done a really good job. And he gave me a lot of encouragement, which, in your first 6 months of work, you really are not sure, how do you compare? So then I think I learnt that actually I perhaps did have something to offer. So my tactic as a leader has been to try and find those people. Sometimes they come and find you. So I can remember when I was about to move into Leeds as the chief medical officer, I got an email from somebody who was a new consultant in elderly medicine. And she said to me, I'm really passionate about patient safety. It'd be really nice to meet you when you arrive. So, she was somebody I met as soon as I possibly could. But I also wanted to meet as many people as I could. And then talking to people, I think particularly colleagues who have been less enthusiastic to come forward, less confident. So I'm talking about females, I'm talking about people from different ethnic backgrounds who haven't necessarily seen themselves as having the confidence to lead, and talking to them and saying, you'd be great in this job. And often it's because, they're not the most senior by age or senior by years of service that holds them back. And when you say, actually, it doesn't matter about that, this is about, you've got ideas, you're great with people like what you say, or they are followers, whether you recognize that or not. You've got a set of followers, and being able to take them and support them through that leadership journey. I think I was also pretty good at recognizing people who needed to take it steadily, shall I say. They didn't want to leap straight into a clinical director role. It might have been through medical education, it might have been through research, it might have been through quality improvement. It might have just been, don't go for that clinical director role yet, but let's see you in a clinical lead role. But the other key thing that I did was to ensure that we had leadership development programs available for the doctors in the trust, and actually to say to people who were new in, I'm talking really now in consultant roles, but actually it evolved to become, particularly for our SAS doctors and also for some of our advanced nurse practitioners, we really want you to go on this leadership development program. And actually, I sort of expect you to do it. You may not want to be a leader at this stage, but you will learn about how the organisation works. You'll make great networks that will help you when you are trying to build your team and your service. And what we did was have 2 levels of program. So we had, if you like, a foundation course for leadership and development, and then we went on to have a more advanced program. And some of the people that went on that foundation course 5-6 years later were in clinical director posts. And as you've referenced, Simon, I was there up until 2020. So midway through 2020, some of those people who I saw take fantastic leadership roles during a time of unknown crisis, really, for the NHS in terms of the pandemic. And they were brilliant. They had fantastic ideas. They were really motivated, and they got the ideas of their colleagues so that everybody was prepared to follow.
I think what you alluded to there as well is that, and I think we need to be a lot more mindful of, is actually it's okay to make small changes. And sometimes this great big change, I'm going to go and change the world, it's not going to happen. And that's okay. And it's okay to make small changes. In my department, it might affect 1 to 2 people. And then it then ripples out, doesn't it, like that ripple effect? And it starts to affect more and more people. And I think I picked up on you saying that actually small things are sometimes just as important as those big changes. And we sometimes need to recognise that more.
Absolutely, yeah. And again, I think lots of that happens, and it happens in teams. It's not just doctors, of course, who are suggesting those changes. But where you've got really effective teamwork, they just get on with it. They don't necessarily need those same permissions because they've got full agreement. But there is a lot that can be done with small changes.
Yvette, you mentioned about teams, and in your various leadership roles at different places, you've met very different teams. Without naming any particular team, could you think of the characteristics of how as a leader you create an effective team?
Yeah, so I've had to go into new teams where I've been the outsider. Sometimes it's been that team has been quite long established. Sometimes you're going into a team where there's a set of difficult problems that team have not been able to deal effectively with. And I think the first thing is, when you go in, is to respect the other people that are in the team, to make sure you try and meet individually with each of them and understand where they're coming from. I know, Simon, you and I have talked before about understanding yourself, and it's so important that you understand what kind of characteristics you have. Are you somebody that needs a lot of detail? Are you somebody who's a bit fiery red? So that you're trying to understand who are those team members that you're joining and how will you get the best out of them. I didn't do this straight away, this has taken years of learning how to do it. But I think then, you try and understand all of the context in which people have been working in. How can you help? Are there any quick wins that you can do to support that team? But equally, how you then constructively challenge perhaps some of the ideas that have been held for quite some time, but are clearly not proving to be so effective. And I have at times had to be, really challenging. And because for me, what has always driven me is this doing the best for patients? And whether that's about being in a clinical team where you are delivering care directly to patients, or whether you're in a leadership team, and as an executive team, you can be quite remote to that care delivery. But if the motivation for me is this going to be the right thing to do for the patients and the staff? My other motto has always been, how do we make it easy for staff to do the right thing? Because often we've put so many workarounds in. So I'll often quote an example of arriving in a trust where there was a concern about the medical engagement. And when I spoke to the consultants and some of the senior doctors, one of the things that really infuriated them was that their passes, the electronic passes that get you in and out of places, expired every year. And every year they were expected to go to HR with proof of their address, recent, a utility bill that was less than 3 months old, their passport or their driving license. And they physically had to go to one site, despite it was a multi-site organisation. And actually, a really quick win for us and an exec team was to say, why? Why are we doing this? These people have worked for us. Some of them had worked for 20 odd years. And, when people can see that you as a leader can make a difference for them, then they start to listen more to what you've got to say, and they'll take a bit more of the challenge as well, when they see that actually you do understand where they're coming from and you do want to make it easier for them to do their job.
It's a perfect example of a very small percentage change, which had a huge impact not only on the challenge they had to come, but building relationship and trust. One of the things I just want to pick up from what you mentioned earlier about leadership profiles and traditional leadership profiles. As a senior leader, as a woman, and acknowledging your recognition of the CBE from Power and Female Leaders in Medicine, what message should we be putting out there to encourage more diverse leadership? Have we got there? Have we still got room to go? What are your thoughts?
I think we've still got a long way to go on diversity in leadership. We're probably beginning to get there in terms of gender balance, but actually the stats would show that there's further than I'm thinking. But what I recognise is that you won't suddenly have 50% of all the medical directors or chief medical officers being female if you haven't got the stepping stones to those roles. So I think you will start to see there are more female leaders now in clinical director roles, in some of those associate roles. You'll see it in medical education as well. But I think we're a long way off that in terms of people from different ethnicities being represented in leadership roles. And particularly if you compare that with the demographics of the patient population that your organisation is serving. So there are a number of different programmes. I think I know that some people from ethnic minorities have been reluctant to go on to programmes that were designed specifically for them, and the NHS Leadership Academy has run a number of those programmes. And those people, perhaps the British-born, British-trained, haven't felt the need. But actually, I've always said to people, if there's a programme available that would get you onto something quite rapidly and help you to make progress, why don't you take advantage of it? So I think encouraging people to take advantage of all the development programmes that there are out there is really important in helping us to achieve diversity, as well as our recruitment methods and support that we offer people once they are in a leadership role. Because that, I think, is the other thing that I've managed to do, is when we've got people into a leadership role, make sure that you give them support. And my diary often used to be filled with a lot of one-to-ones for people who had come into clinical director roles or associate medical director roles. And I think as a leader, understanding where you need to spend your time in order to achieve, if you look into it, if you get there into an organisation and you think, crikey, the leadership could do with a refresh here, then how are you going to put the training programme in place? How are you going to encourage people into those programmes? And then how are you going to support people once they have taken up the mantle?
Can I just touch a little bit about, I want to talk about barriers actually, and barriers that you've encountered in your career, and how you've overcome them.
Well, I suppose probably for me, one of the most important things has always been still being able to be available to my family. They might laugh actually and say, you were always at work. Even my own iPhone thought that the hospital was my home. But in reality, it was always important to me. So my first consultant role was not in a trust that I particularly wanted to be in, but it fitted with, a distance from home and the support that I could have with my, at the time, very young daughter. But actually, that place was a fantastic opportunity because the growth and development that I was able to achieve personally, but also improve the paediatric departments, was, the scope was massive, and the senior leadership was supportive. So I suppose the first barrier is about making sure that work fits with your personal life as well. But then when time permitted and when I thought, I think I'm ready for a change, I actually moved organisations. In fact, I worked in 3 different organisations. And then, as Simon said, I did some interim stuff after that. So the barriers can be the ones that you set as your own personal standards, if you like. The other barriers, I did come across some sexism at times as well. And there was a very difficult time when I put my head above the parapet and was really sort of pushed back by the senior male contingent in that organisation. And that did knock my confidence. But if I'm honest, I'd probably been quite disruptive in terms of the service reconfiguration led to merger of the trusts. And there were a lot of people who were really unhappy about the merger. But that merger actually then offered me other development opportunities. I've worked in a team that was not a team, where there was a huge amount of change, where I felt really uncomfortable. And I think there are more people that experience that than perhaps acknowledge it. If you're in training, you know you're going to move on. You probably don't have the energy or the know-how to make a change there. But if it's a more permanent team, so my one bit of advice is be very careful about how you pick those permanent jobs. Make sure that the organisation has the kind of culture that you think you can thrive in, and that the team you would be joining are people that you like and respect. You don't have to love them, but you do have to be able to like them. And inevitably, Simon, I know, has probably experienced this, that team will change over time. And I've seen people who have dug their heels in and thought, I'm sticking this out, but I'm very unhappy and I'm going to make sure everybody else is unhappy. And my advice often to people has been, you don't have to stay in this team, and change can be good for you. It can refresh you. The job might actually be the same job, but just going and doing it in a different place, in a different team, can be, I found, very renewing, really. It's a big step to take.
Thank you for sharing that. And I think what you say about change and choices is so important, because we start a consultant role or a senior role and we think we're stuck there for 20, 25 years. And a few years ago, I decided to change. Why not? And I realised I'd made the wrong choice. And a good friend of mine said to me, "You have a choice here, Amy. You don't have to stay." And I was like, "Of course I have to stay. I've signed a contract. This is my career." And she was like, "You don't. You have a choice." And that was probably one of the most important bits of advice I've ever been given, is that I've got a choice.
Yeah.
I can choose where I work, who I work with, where I work. And if I'm not happy, it's okay to acknowledge that I'm not happy and to change.
Yeah.
And that was quite enlightening, actually.
Yeah, really, really important. And I've often said to people who've gone into leadership roles as well, well, actually, most of them are probably a 3-year contract, if you like, agreement. But there's 3 months notice that you can give either way, So we can give you 3 months' notice, but you can give us 3 months' notice. Rarely has it been necessary to invoke that on either side. But it's, you don't need to step into a leadership role and think, oh, now I've got to do this for X amount of time or forever.
Just to touch on one brief thing, there's often a common misconception that you talked about working in a team where you felt that it was never going to work. It was difficult. How do you acknowledge that in yourself and go, it doesn't matter what I do here, it's not going to happen, it's not going to be successful, and walk away?
It is really difficult. Another conversation that I have had with leaders who, if I'm honest, have probably become a bit stale in the role, and maybe you can see that they're quite stressed by it. And when you say to them, have you thought about maybe it's time to do something different? And they'll say, oh no, but I've still not achieved this. I wanted to achieve this change, or this hasn't finished. And I'll say to them, it'll never be finished, because we're always changing in the NHS. There's always a new pressure, a new treatment to be introduced, a new way of doing things. So I think, first of all, acknowledging that, these are jobs, these are not jobs that you complete and say, oh, tick, we've done that. But I also think that knowing that you're under stress yourself, knowing that this isn't working for you is really important to acknowledge, and to know that it's not necessarily because you failed. It's not a personal failure. It's about how this team is gelling. And for me, I was in a situation where I thought this is going to go one way or another. And I applied for another job and was successful, and therefore I was leaving. But I'd also gone through in my head, so what happens if I don't get this other job? What am I going to do then? And I decided I'd have to be even more disruptive again. But that would probably land with me having a lot of responsibility on my shoulders. But if that was the right thing to do for the organisation and the patients and the staff, then that was what would need to happen.
Yvette, you've lovely summed up the emotional intelligence bits of being a leader, which is that self-awareness, that sort of, and self-control and self-management, and sort of mastering yourself, which is really important as a leader. If I was to put you in a time machine with all of your wisdom and experience you have now, and put you to the start of your first leadership post, what advice would you give yourself and other people who are just starting off on their formal leadership journey?
I'd have probably advised myself to be kinder. I don't think I suffered fools, and that I was a bit too direct in my style. I think I was impatient, and that I wanted things to change quickly. I do think they needed to change quickly from the patient's point of view. To work in a department where you've got health visitors saying to you, oh, the families of a child with a disability wouldn't want them to be admitted because, they don't think the care on that ward is good enough. You can't live with that for long. And I think, Simon, I would have, I was lucky to go on some leadership development programs reasonably early on in my career, but I think I'd have taken up the offer for mentoring and coaching more than I did. And the number of people that I have, worked with and said, we need to make sure you've got a mentor. And they go, oh, yes. And even when you've sort of arranged and they've got a mentor, and then when you catch up with them and say, oh, have you had a conversation with your mentor? Oh, no. And equally, when I have either been asked to mentor somebody or, offered to mentor somebody, and they have not particularly taken up the offer. And I don't think it's been about me. I think it's because people get into the mode of they're in the job and they get on and they don't give themselves the headspace or the thinking space. So I think that would have been helpful.
Absolutely. And I get that totally. I can relate to that completely. I think leadership is a journey. I think we get really well trained as doctors, as technicians. We take on leadership roles because we're very good at our job. And we get stuck in the doing. We're trying to make changes. And actually, we need to step back, develop ourselves as a leader, look at opportunities, access coaching, mentoring. And it's still learning, isn't it? It's a lifelong thing to keep learning.
Definitely. Yeah.
I'd really like to thank you for your time, your energy and your support. And actually, what you've done as a leader in the NHS, which has just been phenomenal. Amy, I don't know if you've got any last thoughts.
I think what really resonates for me is actually it's okay to make small changes, and I don't need to try and change the world, but also it's about being kind to others, but also being kind to ourselves. It's really important. I think that's a key takeaway. And also to really understand who I am, because only when I really understand who I am as an individual can I then really be a good leader, I think. And that's the key takeaway for me. Thank you so much, Yvette, for your time. I can listen to you talk for ages. So thank you so much.
Well, thank you for asking me. I've really enjoyed our conversation, and I hope it's of some use to people who are considering leadership roles or who are in leadership roles.